Paul Zane Pilsner, author of The Wellness Revolution, actually said that wellness is the next trillion-dollar industry. It's really where everything and everyone is moving.
I think these long-term relationships is the way healthcare is going to go. We've always said that healthcare is local, but I think it's more than local, it's personal. And the surgeons that I know, obviously I've been friends with them for a long time, but they're, like all surgeons, revered in their community. But some of these guys are their own best agent. The patients see them personally. They don't see the practice, they see that surgeon. Obviously, with the Affordable Health Care Act, there's been increased number of patients coming into the system. They are as busy as they've ever been, but the dollars are dwindling. There's less money spent per procedure, and they're doing more procedures. But there's still a lot of patients that are looking for solutions to their pain, and maybe it's not always surgery.
The reason why patients really like this is because there's no risk involved. You know, they're not getting a foreign drug injected into their face. They're not having to go through these extensive surgeries where they can, you know, potentially get different risk of infection or, you know, have a lot of pain afterwards. Patients love the procedures because there's no downtime and they can see the results actually fairly quickly. There's no limit on how many times you can use your cells to help regenerate your tissue. If anything, the results are compounding.
After 11 years in the stem cell space, promoting, buying, and eventually manufacturing devices and going out and selling them to orthopedic surgeons and various other doctors around the United States, we thought the best example that we could create what this opportunity looks like is to build a facility that services that community that's not a surgical candidate, that is looking for some pain relief or looking for a more holistic health approach. We started a company called BeNew Institute, and it was our interpretation of what a regenerative medicine clinic would look like. Initially, we were just using cells and plasma to reduce pain with people with painful joints, but it gave them hope, it gave them a fresh start, it was a do-over, and in every other part of healthcare, I had more influence to suggest they should lose some weight, I should suggest they eat more healthy, to get on some types of supplements, all the things that became the BeNew Institute. And that type of influence that our doctors had because of this epiphany that the patients got, that if I can look better, I can feel better, and I can be well. And that became our motto. Look good, feel good, be well. And I really thought that if there was a place that I could bolt that philosophy on to people that were well equipped to run this business, it was with the orthopedic surgeons.
What's so exciting about the BeNew Life opportunity is how it supports the doctor in a turnkey approach to bring new patients they might not have normally had into a continuum of care for regenerative and restorative therapy. BeNew Life not only attracts new patients through our superior advertising programs, but we also have patient financing available. So when they come into your practice, you feel that sense that they'll be able to get the care they need and that they'll be able to afford it easily.
What we realize is we have a lot of influence with the patients that come to us because they're looking for us. They came to us because we have this unique take on wellness. For sure, part of it is stem cells. But when they come in, we have an education room. It is not a waiting room. Nobody's waiting for anything. The second they show up at the BeNew Institute, they are working on self-improvement.
We get patients that are coming in to looking for alternatives to different illnesses that they might have, whether it's orthopedic or spine driven, but a lot of it is aesthetic driven, and they're looking for different ways to improve their complexion, you know, get rid of those wrinkles, the signs of aging.
When our doctors became experts in cell therapy, we expanded the horizons of what the therapy was. 2 of the treatment rooms are primarily used for cosmesis, where we're treating the face, which again, by the way, is far outside your wheelhouse, you may think. We get more patients telling us how many people asked what they had done to look so good, and I get referrals from that where people come in and say, can I see your doctor? I'd like to have my knees treated. But again, the idea of looking good, feeling good, being well, we love that paradigm. For sure, our doctors like this new patient that they're seeing. But again, without, I think, the structure of BeNew Life, without the scientific angle, maybe you don't see them as much because they're educated. They know what they're looking for. And when they show up at the BNU Institute, they know they found it.
We really look forward to where cell therapy is going to take us, not only in the aesthetics markets, but in other disciplines of medicine as well. No matter what we're looking at, BNU's at the forefront of the journey.
I'd say for any board-certified physician who's interested in this opportunity, I'd have them contact BNU Life and talk to one of the new franchisee directors and see if this is the right fit for them. And if it is, I would encourage them to take that first step.